Hey there, and welcome back. I'm so excited to welcome you today to talk about speech pathology, speech therapy, and this is super exciting because we have Sarah Dowling with us today. And this is something I know that all of you are going to want to listen to because we all have questions as parents. Is this something that my kid needs? What's going on as they develop language? Stuff happens, and I know my son, when he was young, he had a really bad stutter for a little while. And then I could see his brain, as his brain developed and it hit a new level, he would start to stutter a little more. And then it would kind of back off, and then he would go through these phases. And I was told by a language therapist that that just wait, just hold on, just not. He was really little. He was probably like 3 maybe. And I was like, okay, because I'm kind of freaking out, right? And so I waited, and it really just, his brain finally caught up to his mouth. And I think that's what, or his mouth caught up to his brain is actually what happened. I think that's more of like it. But I'm super fascinated by language. I think it's amazing. And Sarah has such a great background in speech therapy and speech pathology and specifically in working with schools, which is what I want to talk about. And I know she has a really amazing philosophy about how we can work clinically with kids, but we can also work with their education and educationally, and keeping that in mind. And I love that she has that because, man, we are right on the same page there. We both have school experience, and it's something to where as we're talking about homeschooling, this is such a beautiful place because we're integrating all of that. We don't have to send them to school, so we're integrating the education with their development. And this is something that we can do a lot ourselves on. I'm sure Sarah's going to talk about that. But thank you so much for joining us today, Sarah.
You are very welcome.
I'm excited for our conversation today. Sarah, you've been in speech language pathology for a long time, and you've had a full career working in education and doing clinical stuff too. So I'm really excited to hear about why this is so, and I know we've already talked about this separately, which is why I'm so excited for you to share it with everyone. Why are you so passionate about this?
So, yes, I've had a long career and I've worked in lots of different places. And as you can probably tell, I'm originally from the UK. And I worked half my career working for other people um, in the UK, in health, in schools. I worked in a private school for a while where there were very small classes, speech therapist and a teacher and an EA, an educational assistant in each classroom. And that was an amazing experience and transformed my career because I lived and breathed 10 children for a whole year. Followed them around every single classroom. We had to follow them. That was the rules in the school, was the speech therapist had to be in every curriculum area. And then it was in the host class that we did any pull out, if they needed anything for that. But even then we worked mostly in the classroom with our teacher. Um, and we did holidays every year. We built up to going on a vacation, where some outdoor pursuits or going on one of those barges on canals that you see in British TV programs. And we had our own school barge, canal boat. And so that was an amazing experience. And then I learned so much and thought, well, why can't this happen out there in the mainstream world? So then I got a job in Southwest Scotland, and helped redesign the department there and worked closely with the education service to design a service that was more appropriate for working in schools. Then I decided I just wanted to change and emigrated with my husband to Canada, and found a school district that was already aligned with how I was thinking. So I was really into problem solving with teachers, really interested in going into their classrooms and reassuring them and problem solving and designing things that could actually happen in their classroom. It didn't need to be me in a room down a hallway working with the child, being the expert, you know. Um, and I learned that actually disempowered teachers, and that really I wanted to work in a more empowering way and make them the experts and just give them some more tools to use. So that's how I arrived in Canada 25 or more years ago. And played at that for years and years and pushed the boundaries of that way of working, and didn't always get it right. Nothing's perfect. Um, and then I just needed a change, and now I've set up a business where I'm trying to help, and I am helping school-based SLPs learn how to work in a more collegial way with teachers, um, more collaborative, and neurodiversity aligned, and all that sort of thing. So yeah,
Yeah.
so that's where I am at the moment. Yes, and I
That's
have a
so
small private
huge.
practice where I have some homeschoolers. So
I love
yeah.
it. Yay. So she knows homeschoolers too. Don't you worry about that. I love that you are working with teachers and that you're also working with parents now too. And this is something that I feel like we're constantly thinking about as parents, and we're not really sure. So having that empowerment of knowing of what we're doing, because I know I was freaked out when my son had the stutter, and then just that one friend, she was just so reassuring, and she's like, "Hey, man, don't worry about it for right now. It's still early." And I was like, "Okay." And so knowing that is so huge, and we think we need to. But I really love also how you are working with the neurodiversity, because having those kids integrated into our classrooms and into our schools and in our homeschool too, because we have kids sometimes who are neurodiverse, and then kids who even in our own families who are not neurodiverse, and all those dynamics play off each other. I was just talking to a somebody at our dojo, a mom who said that her youngest son is 2, and he has amazing language. Like, I was noticing he's saying all kinds of things every time the boys were, our students in the dojo were, putting each other on the floor and doing their self-defense. He would go, "Oh my gosh." And he's 2, right? We're dying laughing. It was so funny. But her older son, who's, I think he's 5 or 6, he has language delay, and he has some language issues, and he's stuttering. And her 2-year-old is mimicking her her older kid. And so she's like, "Gosh, I don't, how does that work out?" And so
Mm.
I love that we're talking about this today. It's so, so important. Can you just tell me briefly, just for those of us that don't know, who haven't been in the education world, haven't been through speech therapy or anything, what is a speech language pathologist and what do they do?
Okay, so we're in North America, we're a master's qualified profession. Um, and we are interested in anything to do with speech, language, communication, and swallowing is also part of our remit.
Mm.
So we're involved in that with adults and children who have. Some people are involved with babies. As soon as babies are born, there are speech language pathologists who are working with kids with cleft palate, swallowing difficulties, failure to thrive, things like that. So that's a whole world that I'm not involved in, and I hardly know anything about. But my niece was born with a cleft lip and palate, so I was really impressed. That there was day one there was a speech language pathologist helping my sister, so that was amazing. But the speech world is what most people know us for, and it is actually the thing that we're the most specialized in. But we are specialized in a vast range of knowledge. So speech, most people know about, but speech is a vast area as well. I think you might have a bit of a linguistics background, but there's whole layers and layers to speech, from movement to
Mm.
thinking about speech, to planning
Mhm.
speech, to knowing about syllable structure, sounds in words, the different types of sounds and how they contrast, um, to make all the different words. Um, and so that's a whole area where we do might have to do a detailed assessment to unravel what's going on and find the system that the child set up, um, and then move them forward so they can learn new systems and improve their speech. Then there's language. We're interested in vocabulary. We're interested in grammar. We're interested in social use of language. So like narrative, telling stories, having conversations, being able to follow conversations. We're also interested in nonverbal communication. So gestures, facial expression, body language, because that's how a lot of children communicate, especially, in the early days, if they haven't got a lot of language, they're often using because they know what they want, but they're
Right.
struggling to say it. So they might be grabbing you by the hand, or they might be pointing and gesticulating and acting out what they want you to know. So we need to know about that world as well. Um, and we're also interested in the impacts of other defined or diagnosed, areas, diversities like autism, fetal alcohol, intellectual disabilities, psychiatric impacts. I was involved a little bit in Scotland with psychiatry, um, and so things like that. We're interested in a whole raft in the adult world, and even in the child world. Brain injury, um, strokes, anything that affects the brain can have an impact on language and communication. So it's a vast field that's expanded exponentially during my time in the profession from the 1970s now to the 2025, 2026.
Yeah,
So
that's
yeah, it's
fascinating.
vast, absolutely vast. And so when we often are, as often professions are, frustrated when people don't understand how broad our world actually is. Yeah.
Yeah, I
Mm.
I mean, I had no idea about the swallowing and the cleft palate and things like that. It's really fascinating, and absolutely, you would be involved in every part of the language, whatever that is, as well, which makes so much sense. And yeah, I always say that about writing. The writing is there's so many skills involved in writing as in speech as well. There's so many
Yes.
skills involved from, like you said, cognitive thinking to understanding language to syllables to the actual formation and the sounds and the mouth movements and the voice and the breath and oh my gosh, so many things, right? That's
Yes.
I'm actually geeking out on that. So fascinating. I love that. It's you guys might not be geeking out on that, but I think it's fascinating.
Yeah, yeah, we
So
totally geek out on all that.
I know, I know. I think it's really cool. And so when we're thinking about our kids, let's just start from the beginning and thinking about our kids from the very beginning when they're starting to develop language skills. We know it's a lot of mimicking, it's a lot of what's happening in our surroundings. And so how does the language develop in how do we know, I guess I should say, how do we know if the language is not developing correctly?
So some of the clues are that the child might be getting frustrated. So I mean, children
Mm,
get frustrated anyway. We know
yes.
that. But but if they feel like they've got more to say, or they've got more ideas, and they're actually able to get out, and they're getting frustrated with themselves, and they're getting frustrated with you, then we don't want a child to go down that road. So if you've got any signs of that, speech language pathologists are very happy, like your friend was, very happy to be contacted. Sometimes there's wait lists, depends where you live, Um, but it's better to get on a wait list and then find out there was nothing that you need to worry about, that it was just a phase and that the child's come through that phase. But, a an hour appointment with a professional, can be so reassuring. Um, but then if there is something and you are seeing the first signs that the child has some difficulties developing language, then at least when you get there to meet the speech language pathologist, then you can start to get some ideas about where your child is compared to typical development, and get some ideas and often some suggestions of what you can do at home. They often do a triage type appointment and then decide whether you're, just going to be seen every few months or every month or every week or whatever is needed. So as speech language pathologists, we know there's some hesitancy out there that people don't want their children labelled, but we don't label. We're just looking at the child. We often just play with the child on the floor. If they're a young child, we're just playing. And it looks like we're not doing anything, but our brains are working like mad when we're doing that playing. We're observing a lot. We're analyzing. We're testing things out. Um, and so it looks like we're just playing on the floor, but actually the brain's working like mad, and we're working lots of things out. Um, so yeah, so that's what I would encourage. It's not a negative thing to do, although we're aware that people feel very anxious about meeting a speech language pathologist. Yeah. with
Yeah,
with a
it's
nice
always
on the
helps to
whole.
ask, right?
Yeah.
Just to give I know I needed peace of mind back then. I
Yeah, it just
needed
gives
that.
peace of mind,
Yeah.
reassurance that this stuttering is part of normal development, and your child didn't have no indicators that he was going to go on to have a disordered dysfluency. Yeah, it was just
Yeah,
typical.
and I love that you brought up the frustration too, because that's something that I often talk about is the one of the triggers for understanding whether love of learning is dropping. And so that frustration, when they're pushing back, right? Or
Yeah,
there's something happening to where something's not right. The more you push, like my mom used to she just would get frustrated, I guess, herself, or she wanted to help him. And so she would start to finish his word for him. And I'm like, just wait, just stop, just wait, let his brain, his mouth will catch up with his brain. Cause you could
yeah,
see his brain was way down the road and
yeah,
his mouth wasn't there yet.
yeah,
And I'm like, just wait, he'll get there.
yeah,
And just let him get there. You just have to be patient. And so she got better at that.
yeah,
And then it became not a problem. But that's something that frustration is really important, and I think that's the difference. Uh, he was never as far as I can remember, he wasn't frustrated about it. He was like, "Oh, this is just a thing," but it wasn't really getting him down, like, an inability to communicate, so
yeah,
I love that
yeah.
distinction because I think that's huge.
And the environment that you provide for your child is really important, and that's where SLP, a speech language pathologist, can really help. Is see that you're using the correct, an appropriate way of interacting and supporting the student, or whether you need some more tricks, some more strategies to use. So for stuttering, yeah, absolutely. For somebody who's got a disordered dysfluency into adulthood, you never finish their sentences. You never butt in. You always let them finish because their neurology, we're now finding it is a neurodiversity. It's the same as any other neurodiversity. We're not going to fix a stutter. We can find strategies, we can reduce the impact, we can support the person to feel good about themselves, um, but don't finish anything for them. Like, don't interrupt them. And so, yeah, it's the same as with um, if a child is using a communication device, we don't butt in. We let them poke around and find what they want to say with the communication device. We give them the time for their brain to formulate that. Um, so it's the same with with autism. We're patient while they're trying to sort out this social communication world. Um, that's what we're trying to do. And with speech, I often say to children, what are you good at? So what you're good at. So say you're good at judo, then you say, oh, you're really good at that. Are all the children good at it? When you go, and go, no, no, and so, well, they're still learning how to do that. So you're still learning how to do some speech. It's just another thing that you learn when you're a kid. So we're just going to practice some speech, and you're going to catch up. And
I love
often,
that.
when you present it like that,
Yes.
it's not a thing to feel ashamed about. It's just
Yeah,
different. Yeah,
I love that mentality too. And it's hard for us as parents sometimes when we have multiple kids and they're like all screaming at one time and somebody needs this and somebody needs that. One of my best friends, she had her youngest one didn't speak for like it was 3 or something because and she was all worried about it. And her mom just like watching the situations like he doesn't need to. He
yeah,
hasn't yet needed to because everybody just knows what he needs in the house and just hands it to him.
yeah,
So he hasn't really needed to
yeah,
communicate
yeah,
because all he has to go is fuss a little bit and here you go. Like
yeah,
that's
yeah,
there were 5 other people in the house that were giving him what he needed. So he
yeah,
was like, why do I even bother?
yeah, yeah, yeah,
But
yeah.
that's something I love that it's all different and we have to just pay attention to our individual kids in that way. What about kids when they're older, when they have patterns that they're already habitual and they how do we support them and help them get out of that?
So with speech, it depends. If it's a speech disorder, it depends on the reason why they
Mm.
have the speech disorder.
Mhm.
So if it's a more motor planning, neurological, more related difficulty, then that can be harder to change. And an older child over sort of 8, 9 years old has to be highly motivated to want to work on their speech. There's a certain
Mm.
point where they've had enough, especially if they've had speech therapy for a while. They might be just saying, "No, I'm done. I'm just not going to do this anymore." So sometimes when the hormones kick in, and that social lens changes in the teen years, that might be another time to try and see if they want to change, if they're prepared to maybe learn, see if we can get a little bit further. And then also we'll be teaching more strategies, because if that's their natural level, if they really can't progress any further, then it's about strategies. It's about, are you aware when somebody hasn't understood you? What can you do if somebody hasn't understood you? What are your backup systems?
Mm.
If they can spell and write, which often our children who have got severe speech disorders often can't, because literacy is so tied up with speech and language. Then you might be able to use that. Otherwise, you might be looking at communication devices if they're really unintelligible. Or you're looking at managing their frustration, trying to keep their self-esteem intact and feel good about themselves. So for autism, if a child is stuck in a way of communicating, a way of being, then we just have to see if we can use that way of being, or use their interests, use what they're fascinated by, to see if we can model and help them with some different ways. Try to increase their awareness of, reading the room, seeing what's going on around them, see if they can notice that the communication's not being as effective as it could be. But even then, it depends. Like I have had to discharge and stop working with some teens, and I particularly like teens with autism, um, because they're not motivated. And a big strand of autism is not having that social motivation for
Yeah.
learning and for change. So you'll learn what you're interested in, but you're not going to be socially motivated to learn something. And so that frustrates parents and teachers and therapists like mad, of course, because we want them to learn this stuff. But I've just said, look, just keep providing life experiences. Make sure they've got a broad raft of experiences, and just keep doing that. Just
I
keep
love that.
in. And so, speech therapy for me, I just had to walk away and just said to parents, you know what? These kids have got a broad life. Keep making them have a broad life. Keep providing those opportunities, and they'll get where they're going to be. These are super bright kids who are going to go to university,
I love it.
and they were going to be interesting people. They'd found friends. They were doing fine, but they just weren't where the parents wanted them to be. But I said, actually, I think
Right.
this is fine. They're going to develop. They're going to keep developing. Um, so
That's
so
good to
yeah.
look for
So
that.
it can be hard making some of these choices.
Yeah, and it's good to notice the different motivation levels too. And like you said, I love that the teenage years when they do start getting their social world a little bit more bigger, then yeah, there's a little bit more pressure there to do improve in certain ways. So
Yeah.
I definitely do acknowledge that, having been a high school teacher myself, I do know that that is true. So not all the time, but
Not all the
that is
time.
the case. And then something you mentioned was that you were talking about the way that speech has so much control over writing. Can you talk about that a little bit? I'm so fascinated about that.
Yeah, speech language pathologists are fascinated by literacy. We are illiteracy experts, and it's known that certain children with certain types of speech difficulties are almost of a high chance, and some of them are almost guaranteed to have literacy difficulties, because the parts of the brain that processing speech sounds and syllable structure, and language, are underpinning everything that's needed. All the literacy is riding on the top of that language area. So we're using the same parts of the brain. So if you're struggling to understand how words are created, and you can only produce a word, instead of saying cat, you're saying da, then how you haven't worked out, what the syllable structure of that word is. And often spelling, so you can actually teach spelling and speech in a way that supports each of them. So we're passionate about teaching phonological awareness. We're passionate about linking speech and letters and, the sounds and all that together, building up syllables, understanding the rhythm of language, so syllable structure, 2-syllable words, 3-syllable words. Um, so building up all that together. Um, and so you can often, some children, I'm working with a kid who's got an intellectual disability, and he's quite a character. And he's in his grade 7 year, and he has had a phenomenal literacy program. Phenomenal. He can spell, and we're using it to do his speech because he's got a very severe childhood apraxia of speech, which means he's difficulty moving his mouth. And when I first met him, he was just like he wasn't even producing any consonants, hardly at all. And now he's able to say upset in a structured situation. Like he can say, cookie. He can do all this. We went straight into what sounds can he produce? And now let's make them longer words. Let's get that final sound on. So instead of just saying da, let's get dat for cat. And then let's eventually see if we can get cat. Now let's see if we can get cookie. We're just building up, trying to expand what he has. And it's phenomenal to see it, but we are just using written words. He's so motivated because he knows he's good at literacy. He's so motivated just to read words. Like it's so boring what we're doing, but he loves it. So,
Oh,
and it's helping his speech because he's got that visual support.
I
Um,
love
so they're
that.
two so related. And then of course, narrative structure we're passionate about because story structure is something you need to have life. If you to have a conversation, you tell
Yes.
stories. And so to be able to tell a story, so building up that narrative structure, beginning, middle, and end, character setting, the actions that change the event, and everything coming together at the end, the emotions and the feelings, and what was the conclusion, what was the outcome. That's essential for a conversation. And so we're passionate about that as well. So that links to writing stories. So we're very keen on supporting teachers in doing that as well. Um, and inferencing, um,
Yes.
all prediction, all those
Yes.
things, all tie into literacy. So vocabulary development, um,
That makes so much
reasoning,
sense.
executive function, critical thinking, they're all language.
Yes, they really are. I love it. And as you're talking, I'm like, oh, and that's reading. And then there's I'm
Yeah.
like, I'm categorizing that. That's so fascinating. And when you think about how the sounds develop, and it's interesting that that one child had really great writing literacy development and without having the language the speech, and that's obviously his brain is working just the mouth part, but it's fascinating. You can develop those areas together and they all work interchangeably. So when we're working with our kids at home, that's something that we think about as we're writing and reading and talking and discussing. These things are all super important, and as well as motor function. I'm sure that because I know that there's a brain linkage between how we're writing and then how we're processing.
Oh gosh, yes.
So it's
Yeah.
huge. And so I love that all of this is integrated and you can really help your child in so many different ways at the same time. Let's think about for a minute, because I know you have a huge passion in making sure that your speech therapist and language therapist are working with education and not just in a clinical sense. Can you share about the differences between that really quickly?
Yeah, so obviously with your parents and your families, you'll have a philosophy about, how you want people working with your student. And so if you feel like you do need to work with an SLP to get some support, then you can ask if you can do a trial, you find out if the philosophy matches. You can say, look, I want my child to be worked in a more naturalistic context. I want them to be doing, learning how to be social. I want to develop some conversation. You tell them what your goals are. And then see if they work in the way you want them to work. Sometimes there's a shortage where you are, so you think, well, I've got to just have the one I've got. Um, but we all have different ways of working, obviously, different personalities. Most SLPs obviously are learning to be neurodiverse, and um, but you will meet people who you don't like the way they work. Um, and for example, I've worked with a boy, and I'm I can't do drill and stuff. I'm not very good at it myself. I don't have that. I'm much always been tended towards a more naturalistic way of working, more looking at the context the child is in. And this character, he loves to sing during the sessions, so he's regulating. We just hold hands throughout the whole session, and we do speech stuff and we do narrative. And he sings songs. He'll just say, "Do you know this song?" And then we're singing songs together. And that's his regulation. He needs constant co-regulation. And so that's what we have to do. So whereas, the mum said, "You're the first person that's worked with him like that." Like, it's always been like he had to conform, he had to do what was being asked, he had to, drill and do. And, she hated it. And it's actually been quite traumatizing for her to witness
Yeah.
those sessions. I also like the parents to be with me while I'm working, and I found that actually that's unusual. That actually parents are sort of encouraged.
Hmm.
Let's go away. Where no, I need you at the table to witness what I'm doing, so we can have a
Yeah.
discussion with the child there. So I'll include the child. Say, look, we're just going to talk about this. Like that was really interesting what you did just there. Hey, mum, what is that typical? Like we'll have those conversations during the session. So just finding, hopefully you can find people who um, your philosophies are matching.
Yeah, I
Um,
love that. That's so weird to me that it makes sense, but it's so in the world that we're living in, but it's so weird to me that the parent wouldn't be there because
yeah,
yeah, you have to reinforce that. You have to know what's happening in order to reinforce
yeah,
those things and to keep the culture. It's just, I mean, that's what we do with school and homeschooling and everything like
yeah.
that. So I totally get it, but
Just let
it
the
doesn't
therapist
make
know
any
that you're going to
sense.
be there and you're going to be watching and you're going to be part of this. Yeah.
I
Mm.
love that so much. Oh my gosh, Sarah, we could keep talking
Oh
for
no, we
like
could. We
another
better
half
stop.
hour for sure. So awesome. I feel like this is just the Scooby snack of all the amazingness that you are such a wise and I feel the energy from you is very I would love my kid to work with you because your energy is it's so healing, it's so patient, it's so
Thank you.
heartfelt, and so I know that that comes across in who your characters that you're working with. I love that you call them characters. It's so great. So, thank you so much for joining us today. You guys, I know that you got a lot out of this today, and I know that you're going to want to listen to this over and over again and take those tips and just apply them. And then, when you're looking for a new speech language pathologist or therapist, and you can just take into consideration those things that we're thinking about. So I thank you so much for joining us today, Sarah. I'm
You're
so
very
appreciative of
welcome.
you. And I know that this is not going to be the last that we see of you. So we will catch you next time. Bye bye,
Yeah, we
guys.
will do. Excellent. Thank you.